Hello everyone, my name is Zoya. Today I am going to take you to a hospital. A hospital is a big building where doctors and nurses take care of sick or injured people. I am not very sick. I just have a small fever and a cough for 3 days. So I made an appointment to see a doctor. You will learn many new English words about hospitals, doctors, medicines, and health. So let's begin. Right now I am standing outside the hospital. It is a large white building with many windows. There is a big red cross symbol on the front. A red cross means it is a hospital. I can see an ambulance parked near the entrance. An ambulance is a special vehicle that takes sick or injured people to the hospital quickly. It has flashing red lights. I walk towards the main entrance. The doors are automatic. They open when I come close. I step inside. The first thing I notice is the smell. It smells like medicine and cleaner. The hospital is very clean. The floors are shiny. There are many people sitting on chairs. Some people look worried. Some are talking softly. I see a large desk right in front of me. That is the reception desk or information desk. There are 2 ladies sitting there. They are wearing white uniforms. They are receptionists. Their job is to help patients find where to go. I walk towards the reception desk. I stand in front of the receptionist. She smiles and says, "Good morning. How can I help you?" I say, "Good morning. I have an appointment with Dr. Sharma at 11 a.m. She asks for my name. I say, "My name is Zoya." She looks at her computer screen and types my name. She says, "Yes, I see your appointment. Have you been to this hospital before?" I say, "No, this is my first time." She gives me a small paper. This is called a registration form. A registration form is a paper where you write your name, age, address, and phone number. She gives me a pen. I find an empty chair near the reception. I sit down and fill the form. I write my full name, my age, 22 years old, my phone number, and my address. It takes me 2 minutes. Then I go back to the receptionist and give her the form. She checks it and says, "Thank you. Please take this token number. Your token number is 25. Please sit in the waiting area. The nurse will call your number when the doctor is ready for you." I take the small piece of paper. It says token number 25, Dr. Sharma, room 3. I say thank you and walk to the waiting area. The waiting area is a large room with many plastic chairs. There are about 15 people sitting and waiting. Some are reading magazines. Some are looking at their phones. One small child is crying. His mother is trying to calm him down. I find an empty chair near the window. I sit down. On the wall, there is a big TV screen. The screen shows token numbers and room numbers. Right now it shows token number 21, room 3. That means patient number 21 is inside room 3 with Dr. Sharma. I look at my token, 25. So there are 4 people before me. I have to wait. I look around the room. I see a water cooler in the corner. A water cooler is a machine that gives cold water. Some people are drinking water from small paper cups. I also see a vending machine. A vending machine is a machine where you put coins and get snacks or drinks. I see someone buying a packet of biscuits. I also see a small table with some old magazines. I pick up a magazine about health. I flip through the pages. The pictures are interesting. I read a small article about eating fruits and vegetables. This helps me pass the time. I wait for about 20 minutes. Then I hear a voice from the speaker. A nurse says, "Token number 25, please go to room number 3. That is me. I stand up, take my bag, and walk to room 3. I knock on the door of room 3. A voice says, "Come in." I open the door and step inside. The room is small but clean. There is a desk, a computer, 2 chairs for patients, and an examination table. An examination table is a bed where the doctor checks your body. It has white paper on it. Dr. Sharma is sitting behind the desk. She is a woman, maybe 40 years old. She is wearing a white coat. A white coat is a long white shirt that doctors wear. There is a stethoscope around her neck. A stethoscope is a medical tool that doctors use to listen to your heart and lungs. It looks like a tube with two earpieces and a metal disc. I sit on the chair in front of her. She smiles and says, "Hello, Zoya. What brings you to the hospital today?" I say, "Hello, doctor. I have had a fever for 3 days. I also have a cough and my throat hurts." She listens carefully and writes notes on her computer. She says, "Let me check you. First, I will check your temperature." She takes a small device and puts it near my forehead. It beeps. She says, "You have a mild fever, 100.2 degrees Fahrenheit." Then she takes the stethoscope and puts the metal disc on my chest. She says, "Take a deep breath." I breathe in deeply. Then she puts it on my back. She says, "Your lungs sound clear. That is good." Then she looks inside my mouth. She uses a small stick called a tongue depressor. She says, "Open wide and say ah." I say, "Ah." She looks at my throat. She says, "Your throat is a little red. It is a viral infection. Nothing serious." Dr. Sharma sits back down. She says, "You have a viral fever. It will go away in 3 to 4 days. I will give you some medicine. You need to take rest, drink warm water, and eat light food like soup and khichdi." I listen carefully. She starts typing on her computer. Then she clicks a button and a printer starts making noise. A small paper comes out. This is the prescription. A prescription is a doctor's written order for medicine. It tells the pharmacist what medicine to give you. She hands me the prescription. I look at it. It has 3 medicines. One is for fever. One is for cough. One is for sore throat. It also says how many times a day to take each medicine and for how many days. She says, "Take 1 tablet for fever after breakfast and dinner. Take the cough syrup 2 times a day, morning and night. And take the throat lozenge 3 times a day." A lozenge is a small candy-like medicine you keep in your mouth and let it dissolve slowly. She also gives me a second paper. This is a lab test form. She says, "I want you to do a blood test. Just to make sure everything is normal. Go to the laboratory on the ground floor. They will take a small blood sample. You will get the report in 2 hours." I say, "Okay, doctor. Thank you very much." She smiles and says, "Get well soon. Come back if you don't feel better in 3 days." I take both papers, the prescription and the lab test form. I stand up and leave the room. I walk out of room 3. I look at the hospital map on the wall. The map shows that the laboratory is on the ground floor, near the back of the building. I take the stairs because the lift is full. I go down 1 floor. Now I am on the ground floor. I see a sign that says laboratory with an arrow. I follow the arrow. I reach a small room with a glass window. There is a nurse sitting inside. A board outside says blood test/pathology lab. I go to the window. I give the nurse my lab test form. She reads it and says, "Please sit on that chair." She points to a chair near a small table. I sit down. The nurse comes out of the room. She is wearing gloves on her hands. Gloves are plastic coverings that keep everything clean. She says, "Please give me your left arm." I give her my left arm. She ties a rubber band around my upper arm. This is called a tourniquet. It makes my veins more visible. She asks me to make a fist. I close my hand tightly. She cleans a small area on my arm with a cotton swab. The cotton has alcohol. It feels cold. Then she takes a small needle. She says, "You will feel a small pinch." I look away. She puts the needle into my vein. I feel a tiny pinch. Then she fills a small tube with my blood. It takes only 10 seconds. She removes the needle and puts a small cotton ball on the spot. She says, "Press this for 1 minute." I press the cotton. Then she puts a small bandage on it. A bandage is a sticky strip that protects the small wound. She says, "You can collect your report in 2 hours from this same window." I say thank you and leave. Now I have to buy the medicines. The pharmacy is on the ground floor, near the main entrance. I walk towards it. There is a sign that says pharmacy/medical store. I go inside. The pharmacy is a room with many shelves of medicines in boxes and bottles. There is a counter where the pharmacist stands. A pharmacist is a person who gives you medicine according to the doctor's prescription. He is wearing a white coat like the doctor. I give him my prescription paper. He reads it carefully. He goes to the shelves and picks up the medicines. One is a small box of tablets. One is a bottle of cough syrup. One is a strip of throat lozenges. He puts them on the counter. He says, "Please wait. I will put the labels on." He prints small stickers and sticks them on each medicine bottle and box. The stickers tell you how much medicine to take. He says, "The total is 320 rupees. I take out my wallet and give him 500 rupees. He gives me 180 rupees back as change. He puts the medicines in a small plastic bag. I take the bag and say thank you. Now I have my medicines. I feel relieved. I open the cough syrup bottle and read the label. It says, "Take 5 milliliters twice a day." I will start taking it tonight. I have 2 hours to wait before I can collect my blood test report. I go to the hospital cafeteria. A cafeteria is a small place inside the hospital where you can buy tea, coffee, snacks, and light meals. I buy a cup of hot tea and a bread pakora. I sit at a small table and eat slowly. After 2 hours, I go back to the laboratory. I go to the window and say, "I came for my blood test report." The nurse asks for my name and finds the report. She gives me a paper with many numbers and medical terms. I don't understand most of it, but the last line says all parameters are normal. That is a relief. I take the report and go back to Dr. Sharma's room. The nurse lets me go inside without a token because I already saw the doctor earlier. Dr. Sharma looks at the report. She says, "Everything looks normal. Your fever will go away in a few days. Just continue the medicines and take rest." I say thank you again. She says, "You are welcome. Take care." I leave the room. Part 9. Paying the bill and leaving the hospital. Now the only thing left is to pay the hospital bill. I go to the billing counter. The billing counter is where you pay for the doctor's checkup and any tests. I stand in line. There are 2 people in front of me. When it is my turn, I give the cashier my token number and my lab test form. She types on her computer and says, "Doctor consultation fee is 500 rupees. Blood test fee is 300 rupees. Total is 800 rupees. I give her 800 rupees. She gives me a receipt. A receipt is a paper that shows I paid. I keep it safely in my bag. I walk towards the exit. I pass by the reception desk. The receptionist smiles and says, "Hope you feel better soon." I smile and say thank you. The automatic doors open. I step outside. The fresh air feels good. I was inside the hospital for almost 3 hours. I am tired but happy that I got medicine and the doctor said it is nothing serious. I walk to my car. I put my medicine bag on the seat. I sit for a moment. Now the only thing left is to pay the hospital bill. I go to the billing counter. The billing counter is where you pay for the doctor's checkup and any tests. I stand in line. There are 2 people in front of me. When it is my turn, I give the cashier my token number and my lab test form. She types on her computer and says, "Doctor consultation fee is 500 rupees. Blood test fee is 300 rupees. Total is 800 rupees. I give her 800 rupees. She gives me a receipt. A receipt is a paper that shows I paid. I keep it safely in my bag. I walk towards the exit. I pass by the reception desk. The receptionist smiles and says, "Hope you feel better soon." I smile and say thank you. The automatic doors open. I step outside. The fresh air feels good. I was inside the hospital for almost 3 hours. I am tired but happy that I got medicine and the doctor said it is nothing serious. I walk to my car. I put my medicine bag on the seat. I sit for a moment and think about all the new words I learned today. Hospital, ambulance, receptionist, registration form, token, waiting area, examination table, white coat, stethoscope, fever, cough, prescription, lozenge, laboratory, blood test, tourniquet, needle, bandage, pharmacist, pharmacy, cafeteria, billing counter, receipt. So many new words. I start the car and drive home. I will take my medicine, drink warm water, and rest. Thank you for watching. If you want to learn more English words, watch my other videos on airport, restaurant, and shopping mall. Please like, share, and subscribe Helper 0711. Bye bye and take care of your health.